I will discuss most important disease conditions. So that is the Huntington disease. Here, before going to the Huntington disease, we should know the some part of the brain. Responsible for that is coordination as well as the balance and coordination as well as movement. Here, that is motor cortex, cerebellum as well as there is basal ganglia. So this is part of the brain responsible for that is the balance, coordination as well as muscle movement. Here Huntington disease, in the Huntington disease there is the basal ganglia is affected. Here the Huntington disease also called as that is chorea or a Huntington chorea or a Huntington progressive disease. Here it is why it is called as Huntington disease. It is first studied by the doctor, so that is Hunting. So in the year 1872, for that reason it is called as Huntington disease. Now coming to the incidence of that is Huntington disease, it affects in that is 5 to 10 people per lakh populations. It occurs at any age group. Suppose it occurs in that is children below the 20 years of age, it is called as juvenile onset, so that is Huntington disease. So suppose it occurs in the adults, so above the age group of that is 20, it is called as an adulthood Huntington disease. It occurs in the late, so occurs after the 60 years of age, it is called as an late Huntington diseases. Now coming to the that is Huntington disease, sometimes it is called as in chorea. It is chorea, it is derived from a Greek word. In the Greek word, the chorea, it means that is a dance. The persons who are suffering from Huntington disease, they are having a jerky movement or a dance like, so that is the movement. For that reason it is called as so that is chorea. Now come to the cause. So what is the cause of the Huntington disease? The defect in the HTT gene. So that is Huntington genes. It is located on the chromosome 4. For that reason it is called as so that is autosomal. So that is autosomal dominant inheritance. Now come to the one more, the most important cause for so that is the Huntington disease or chorea is so there is a defect or a deficiency in the so that is GABA. So that is gamma aminobutyric acid. Here the basal ganglion cells, that is GABA neurons, they are responsible for producing a so that is GABA. Here the GABA is a inhibitory neurotransmitter. So that is produced in the basal ganglia, but defect in so there is basal ganglia, so there is no GABA productions. So that may lead to increased level of dopamine. It may cause a jerky movement or a involuntary purposeless so movement in the body. Now coming to the what are the signs and symptoms we are going to see in case of Huntington disease. The word for the mnemonic of the signs and symptoms, just remember, so that is word chorea. Here the C stand for so that is loss of coordination as well as the concentration, the defect in the coordination as well as concentration. H is nothing but hyperkinetic movement. H is nothing but hyperkinetic movement. O is nothing but odd behavior or a personality changes, odd behavior or personality changes. S is nothing but it is restlessness. R is nothing but the restlessness, and the E is nothing but emotional changes. Here the emotional changes are so the depression. E is nothing but abnormal gait or the altered gait. So for remembering, so there is a word, so the chorea, the signs and symptoms includes the loss of coordination and so there is concentration, hyperkinetic activity, odd behavior or so the personality changes, restlessness, emotional changes, depression, and the altered or so that is abnormal, so that is body gait. Now coming to the diagnostic evaluations, how we are going to diagnose the so that is Huntington disease. It is diagnosed by so there is physical examination, CT scan and the MRI as well as genetic testing. Now come to the complications from so that Huntington disease. The dysplasia, it means difficulty in so that is swallowing, and so there is the persons who are suffering from so that is Huntington disease, they are always having a suicidal tendencies because they are having hallucinations. So now come to the management. Most important management for so this Huntington disease, because so there is no cure. For that reason multidisciplinary approach is very important. So to relieve the symptoms as well as to improve the so there is quality of life. So this is regarding to the Huntington disease area, so there is chorea.